This presentation, what I want to do is go through some various things about vaccinations. This is just looking at kind of a little bit how vaccinations work, where you might give them, the different types of vaccines that are actually out there, so you have a better understanding when you choose to and know that you need to vaccinate your horse, what's the best method, and understand the different products and things that might be out there. So really, kind of the different things we're going to go through again are knowing that vaccines really are the best defense against any kind of disease. It's kind of always interesting to me that knowing that not everyone always vaccinates their horses. However, it's really very important to do because it really probably is the least cost way that you can minimize some of the chances that your horse might become sick or become ill. Yes, not every vaccine is 100%, or no vaccine is 100% effective, but it does provide you a lot of good protection for your horses against many different types of diseases. So we're going to talk about the different kinds of vaccines that are out there because it can be somewhat confusing, especially if you're trying to do some of this on your own, what you need to vaccinate your horse for, and a little bit of how the different vaccinations or vaccines do work. Alright, so everyone should be familiar with AAEP, which is the American Association of Equine Practitioners, basically the horse veterinarians. And they go through a lot of regular types of things to really look and see what horses need to be vaccinated for, what are the most important diseases, what kinds of new vaccines might be out there on the market, and then looking at different situations that different kind of diseases are related to our horses. So it's important to note that they really look at and put different diseases on two different kind of categories of core-based diseases that we need to vaccinate against, and also risk-based kind of diseases that we need to vaccinate against. So what does all of this mean? Well, really, it's just looking at the severity or the importance of vaccinating your horses from some of these different diseases. So core vaccines are where we're going to protect a horse from the disease that are very common to your particular area. As we move around the United States, everything is not the same. In southern regions or areas where there's a high mosquito population, some diseases are way more prevalent than in different areas. Potomac horse fever used to be a problem more in certain geographic regions, and it's moved much more broad spread. Okay. Also, for core vaccines, they'll put on the list because they potentially have a public health significance. There are some diseases that can be transmitted to people and some things like that. Some diseases are rated as core vaccines because they are required by law or are very highly infectious. All right. So basically, these vaccines are very safe and very effective, and they have a low enough level of a risk that can be used on a majority of horses. And so it's usually pretty broad spread that these diseases should be vaccinated for. So the list for the core vaccines really is very short. Okay, the ones that they list as their core vaccines for diseases are the Eastern and Western encephalomyelitis, or also known as sleeping sickness, rabies, tetanus, and West Nile virus. And really, West Nile virus is something that has come on in the last 20 or so some years, but it is also now listed as one of the AAP's recommended core vaccines, meaning that every horse they recommend should be vaccinated for these different diseases no matter where they're at. So risk-based vaccines are really ones that are based on the risk that that horse is going to face when it comes in contact with this potential disease. So oftentimes they're dependent on location, geographic region. Some things are going to be more prevalent in certain areas of the country than others. Also, it can potentially be related to what the vector for that disease might be. So many of ours, or certain ones, are related to mosquitoes and are transmitted in that way. Sometimes it's poisonous snakes. Some areas of the country, those are not big issues, but other areas of the country, they really are. Also, some other things that can make it a risk-based type of situation are the horse's general lifestyle and their age, such as things as, you know, is he a campaign horse? Is he going off to shows, rodeos, trail rides? Is he an older horse that really doesn't do much? So those are different kinds of things that also are addressed and looked at. So as you'll see, the list of risk-based vaccines is quite a bit larger. So we have things such as anthrax, botulism, leptospirosis, probably ones that not a lot of people think to vaccinate for in certain areas. It's probably a bigger issue. Potomac horse fever, rotavirus diarrhea, which can be soil burn, and if you have young foals, it can be a very big issue. Snake bite, which most likely is not that common in some areas, but other areas it is. The ones that probably most people think about and are a little bit more common of looking at vaccination for are equine herpes virus, also better known as rhinopneumonitis, equine influenza, also known as flu, and strangles, which also might be called as distemper. And pretty much across things, most horse people are familiar with those three and hopefully would think or consider to vaccinate against those diseases. So just how do our different vaccines work? And there's different types, and it's important to understand, and this really is not unique to the horse. I mean, we as people are vaccinated from different diseases also. So basically there's an introduction of some type of pathogen into the system that's going to cause the animal to produce an antibody response. And so when you vaccinate an animal, we have to get the antibody titer up so it can protect that animal against those diseases. So then that pathogen has been modified to stimulate the antibody response, but not enough to produce or create the illness or symptom. So it's kind of like giving that animal a little bit of the disease so they can build resistance to it and build antibodies against it, but not physically get into the entire disease. So there's a couple things that have to occur to make a vaccine effective. They have to be potent enough to stimulate an immune response. So you have to be able to get that kind of response to protect the animal. And also the antibodies must protect against the disease. There's some diseases that these don't really prevent, and this doesn't work. So we have a condition or a disease called equine EIA, equine infectious anemia. If you've ever had a horse with a Coggins test, that is a disease that it tests for. And also EPM, equine protozoal myelitis. The antibodies that are produced really do not protect the horses from these diseases, and so there really are no vaccines available for either EIA or EPM. So when you get into vaccinating your horses, there are a variety of different types of vaccines out there, and so it's probably pretty good that you have a good basic working knowledge of what the different kinds of vaccines actually are. So the first category would be our toxoid, and tetanus toxoid is probably the most common one of these. Basically, it's going to provide the protection against the toxin that's produced by the bacteria that we have basically in tetanus or even botulism. The next main category that you'll see on the bottle is called modified live. And modified live ones are where the virus has something done to it that it can actually stimulate a little bit of the response, but it really doesn't produce enough of an actual cause of disease. So it's kind of like they get a little bit of the disease, but not the full-bore disease. Killed vaccines are where the pathogen is actually dead, so there's no risk of causing any minute form of the disease, but it still can stimulate immune response for those horses. So let's talk a little bit about the antitoxin versus toxoid, and this is really most seen or most familiar with in tetanus. So remember, the toxoid is what's going to actually stimulate the immune system to produce a long-lasting type of immunity to the disease, such as tetanus. So when you give the tetanus toxoid, it's going to take a couple weeks, 2 to 3 weeks from the time that it's given till the horse becomes immune, and they're going to develop so it's a true vaccine that they do develop the antibodies from tetanus. It's important to know that tetanus antitoxin is really just a preformed antibody that's going to provide immediate protection. So once this goes away, then the immunity goes away, so it really is very short-lived. Antitoxin is mainly used if the horse hasn't been vaccinated, or you really don't know any of the status of, say, when the last vaccination was given. So for example, if you end up with a horse you know no history of and he gets a bad cut, you might need to give him the tetanus antitoxin. Some individuals like to go ahead and do it for a newborn foal, whether they might not know the vaccine history of the mare, or some just feel comfortable doing an antitoxin right there at birth to give them that immediate protection. It's important to remember that this is not the true vaccine, and so then at the appropriate time you still are going to need to give that animal the tetanus toxoid so he does develop the immunity to the tetanus the tetanus bacteria, the tetanus problem. So basically for the tetanus toxoid, which is the true vaccine, if for the initial you're going to give them two injections somewhere between 3 and 6 weeks apart for, say, that newborn foal or a horse that's never had tetanus before. Then once they've had that initial 2-dose series, then those horses can be given an annual booster, which is what we give most of our adult horses. It's also recommended that we give those broodmares a tetanus toxoid, and you'll see our other annual things about 30 days before she's due to foal, to allow to get enough antibodies built up there in the mare's colostrum. For the newborn foals, we like to give it about to that 6 or 8 week old foal, and that's nursing off of a mare that has been vaccinated. Then if you, on a different group of horses, if you have a horse, say, that has a penetrating wound, they just stepped on a rusty nail or something like that, and it's a bit away from when they've had their annual, sometimes it's recommended to go ahead and give them a tetanus booster at that time when they're going to be a little bit more prevalent to contracting tetanus. Now for the tetanus antitoxin, really where that's most commonly used is if you really don't know the vaccination history. So you have a horse that got injured and you don't know his background, so you might give him an antitoxin there at the time when the first injury happened. You have a foal that's unable to suckle, so he's not, or nurse, so he's not going to get any of that colostrum from the mare, and so then that might be also a time that you want to give that newborn foal antitoxin. Sometimes you might also have a foal that the mare has not been vaccinated, which is not that common, or you have no idea, so you might want to give those foals an antitoxin. I will say also, though, it can be for some places an industry practice to go ahead and give those brand new foals in the first, if you're there when they foal, an injection of the antitoxin, because it's kind of a feel-good to make sure that they do go ahead and get a little bit of the protection from tetanus before they're ready to go ahead with their regular vaccines. So a little bit more about the modified live versus the killed vaccines. So remember that the modified live really actually reproduces in the host, whatever you've given it to him. It is a type of vaccine that really you're going to get the best, and the very most long-lasting immunity response from it. It might cause a little bit of the disease in the host or in the host animal, however, it's going to be fairly minimal. And some things with the modified live, though, you have to remember and read your packaging to make sure that you handle it and store it correctly. Most of these are going to be needed that they're kept cool, and so make sure you follow the directions on the storage so that you are using a valid or a good type of vaccine. So with the killed types of vaccines, with those, the entire antigenic load is really given when you vaccinate the animal from it. Generally, when you use a killed vaccine, the volume that you have to administer is going to be larger. Remember, all of your vaccines are really dose dependent. It does not depend on the weight of the horse. And so whatever the packaging tells you, if it's 1 cc or 5 cc's, whatever it might be, then you need to give that amount to the horse that you're vaccinating for, because it is dose dependent. So also with the killed vaccines, it does stimulate a little bit of a poor immunity, but it generally is a very safe type of vaccine to use. So to talk about a little bit of one that sometimes can be confusing, or give you an example of something that is both a modified live or a killed virus for similar but different strains of a similar disease, we have Rhinomoon, which I believe is a Pfizer product that is a modified live type vaccine. So for most of our adult horses, or most of our horses that we're vaccinating them against rhinopneumonitis, equine herpes virus, that type of thing, it really is the preferred vaccine. Okay, it's going to be the strongest, most protective kind of response that we give. So for the respiratory form of rhino, it really is the vaccine of choice. However, you have to understand this is a modified live, so it could also potentially cause abortion in those pregnant broodmares. So where it comes into play with different on vaccinating pregnant broodmares for rhinopneumonitis is that for those mares that are pregnant, we want to use the preferred vaccine is a killed virus, which mainly is the pneumobort K. Okay, this vaccine is is okay to use in pregnant mares because it is a killed virus. And generally this is going to be given to our broodmares at the 5th, 7th, and 9th month of gestation to minimize the chance of them developing or having an abortion due to rhino. So how do we administer most of our vaccines? Again, first, it is very important that you read the packaging and make sure that you administer the vaccine the way that manufacturer has developed that vaccine. Most of those vaccines are going to be given intramuscularly, and so make sure that you know what it is. Most of them are going to be relatively small volume, and so the first most common place to give a vaccine is in the neck of the horse. And you can see on the diagram here, or this illustration, you'll look for a line down below the crest of the neck, in front of the scapula, and down here, and go to the center of that. Some horses can have some reactions and sometimes get some sore necks. You can also give this in the hip alongside the tail if necessary, but generally the most common place is going to be in this area on the horse's neck. So I mentioned a little bit about adverse reactions or allergic reactions. In the intramuscular ones is where you might see this occasionally, and you might have certain horses that you do know will have certain reactions. So it might be localized swelling, some soreness in that horse's neck. This one broke out in some hives and some bumps, and so sometimes it's the particular product that's used, and so switching to a different manufacturer sometimes can help avoid some of those allergic reactions. They're not that common, but it is potential that it could occur. Another type of vaccine, administration of a vaccine, would be to do what they call an intranasal. Okay, most of these are going to be a modified live type vaccine, and the two most common diseases vaccinated for using an intranasal type is going to be the strangles, and also some of the influenza are also intranasal. It does provide a bit of a local immunity, and so it has a bit of a cannula that after you load up the vaccine, you basically slide the cannula into the horse's nostril and deposit the vaccine there. So some horses don't like it very much. They'll kind of sling their head and snort and those types of things, and it's thought that that really does help to distribute the vaccine. But also because of some of those behavior reactions, it really is recommended that if you're vaccinating several horses and with both an injectable and the intranasal at the same time, that you give them the intramuscular first and save the intranasal last, so to reduce the chances of it being spread, potentially being administered the wrong way. So a little bit more on vaccinating our animals, and something to think about and also be aware of is that you generally are going to have to give an initial dose and then either 1 or 2 boosters for that particular vaccine, mainly for horses that have never been vaccinated before. Particularly we think of this as our young foals. So the reason for this is the very first time a vaccine is given, then the immune system really is primed, and there's a very small antibody response from that. And generally it takes about 14 days from the time you administer the vaccine for those antibodies to come up and be present. All right? But that is going to be relatively short-lived, and so a second vaccine, a booster, is going to produce a much larger and quicker response that's going to be more sustained. So the immunity generally is at the very most greatest after that booster is given. And so pretty much for everything with our young horses, we will give the initial vaccine and then at the designated time give the second vaccine, and then some of those need a third booster. And we'll show you some of those time frames as we move through the presentation. So not everybody vaccinates their horses, and I always think that's kind of like, I can't really imagine why you wouldn't, but there is a cost involved. If you've got several horses, it can get fairly expensive. But just remember that the other downside is if you end up with a sick horse. And so that's something you really want to avoid, because it can cause those horses to be laid off. You might have vet bills associated. You could even, for some of these diseases, end up losing the horse. So make sure that you always do try to vaccinate those horses for your core disease and your most commonly in your area, the risk-based diseases. And it's important to work with your veterinarian for either them to come do these for you, or if you're going to do them yourself, to make sure that you know when and how to administer the things yourself. So sometimes if a horse might still get sick because sometimes nothing is 100% effective, sometimes there's various reasons for that. One could be that you didn't handle the vaccine correctly. Was it supposed to be cooled? Was it not stored right? Some of those different kinds of things. What about the procedure or the technique that's supposed to be used for this particular vaccine? Make sure the packaging is read so you know, is it intramuscular? There are some that are sub-Q that actually goes just into the skin, and we also mentioned that some are given intranasally, and so make sure that it's administered to the horse the correct way. Sometimes the pathogen kind of evolves. It's a cerevirus where over time different types, strains evolve, and so different combinations need to be developed. Sometimes those horses are already in a state of disease. Sometimes you'll see that horses maybe have started to get sick, strangles, whatever it might be, and so sometimes that's not always the best to vaccinate a horse when they've already started. And again, that's where it becomes important to consult with your veterinarian and see what's going on. Some diseases, like they recommend rhino, to go ahead and vaccinate them on the potential of an outbreak. It just is going to depend, and you need some good consultation to decide what the best method is. Some vaccines don't have the best efficiency. We know those that are for some of the respiratory type illnesses, such as some of the rhino and some of the influenza. Horses can come in contact with it, and so sometimes it's recommended in times when those horses are traveling a lot that they potentially be vaccinated every 60 days. Also, we look at the maternal antibodies if you're dealing with newborn foals. So we'll get into that here in just a second, and sometimes just looking at how the antibodies are in the foals and from what they've gotten from the colostrum from the mares. Sometimes you can vaccinate those foals too early and you're not going to get the response that you desired from the vaccine that you're giving her. So we talk about hypervaccinating, vaccinate pregnant mares, and a little bit of how this antibody thing works in the newborn foals. Well, so it's important to kind of understand, looking at some of these things, as far as that you really need to have as much antibodies in the mare's colostrum as possible. And the colostrum, what we're talking about there, is that first milk of those mares that is going to be present up for the first few days. And it's very critical that our foals nurse those mares and get good colostrum, because this is where the antibodies are going to be to help protect that foal very early until the foal is really old enough to actually vaccinate. So in this slide here, if you can see, the red line is actually the antibodies in the mare, the antibodies in the mare's colostrum. Over here on this axis, we have the level of antibodies, and on the bottom we have the number of weeks that the weeks of age of the foal. So 1 week, 2 week, 5 weeks. So you can see over time the antibody levels in that mare's colostrum will decline. The green line is actually where we want the required level for those foals to be maximum protection. All right. The yellow line is what we have in the foal's antibody, and so you can see when those foals are born and they begin to nurse, their antibody levels are very, very low, and as they're getting their protection from the colostrum from the mares, and then out here about 6, 7, 8 weeks, right, what they've received from the mares is reduced, and they're going ahead and being more sustained on their own. It's very, very critical for these newborn foals that they do get the right amount of antibodies. The best way is that they are able to nurse from those foals, nurse from the mares, and they're going to get it absorbed through their intestinal tract before the first 12 hours of birth, and that is the very best means. There are different products that can be given to those foals after that time if for whatever reason you could not get anything from the mare. So we do sometimes have a situation that's called failure of passive transfer in the colostrum. So for whatever reason, you can see the red line here from the mare that there's really no antibodies received from the mare's colostrum. It might be that the mare died. It might be that she had no milk. It might be that we tested the colostrum and there's simply nothing there. Generally, if this occurs, it's generally because the foal was not able to nurse. There's no colostrum present and those types of things. So you can see over these first few weeks of life where we want it to be here on the green line, the foal has not gotten anything from that mare, and our critical stage is out here about between 6 and 7 weeks of age. So this is considered a full failure, and we've had to have given the foal those antibodies from a different source, either collected from a different mare where he's able to absorb that milk that has a colostrum in it, or also be IV'd with some different products available. Occasionally you have a situation of amino deficiency where you've got sufficient colostrum from the mare, however the foal just has no immunity. This is extremely rare. There is a genetic disorder called chronic immunodeficiency, CID, found in Arabians at certain times where the foal just simply cannot make the antibodies. And generally about here 7 or 8 weeks of age, then those foals really do become sick. And this pretty much is about 100% mortality, and a situation that does occur and something that is very difficult. So there is a little bit of a window of vulnerability, and so really basically between 2 and 5 months of age in pretty much all of our foals, where you can see the colostrum antibodies from those mares has begun to decline, and the foal really has not been to produce any antibodies yet for those adult levels. And so this is where the largest potential for problems can a foal if they did not get the adequate colostral absorption during those first couple of days of life. So to talk just a little bit about what the American Association of Equine Practitioners, or AAP, do recommend for our different groups of horses, and we'll talk about the adults, the broodmares, and then our foals. So looking at the adult horses, and these are ones that I'm going to say have previously been vaccinated for. So pretty much across the board, we look to try to do our annual vaccines sometime in the spring before mosquito season, because many things are transmitted through mosquitoes. For most of these are going to be an annual, that these are only needed to be given once a year. And so the various core diseases are part of what our annual vaccination program of encephalomyelitis or sleeping sickness, tetanus, rabies, and West Nile virus. Most commonly we're going to be doing for encephalomyelitis eastern, western. Southern regions, they also might require the Venezuelan strain. Then the most common of the risk-based diseases that we vaccinate for are the influenza, the herpes virus or rhino, and many anymore do go ahead and vaccinate for the strangles. Now, because the nature of the disease and the vaccines, it's important to understand that for the influenza and the herpes virus or rhino, many suggest that those still need to be given about every 60 days, particularly in times when their horses are being traveled around and around a lot of different horses. For the broodmares, again, in the spring before the mosquito season is really what we look to do, and it's pretty much the same program as our adult horses, however, that I previously mentioned. However, the timing is just a little bit different, because we really want to vaccinate those mares for the core diseases and risk-based diseases about 4 to 6 weeks before they're due to foal. What this allows is for those the mare to build up more of the antibodies within her colostrum, so then she can do a good job of passing that immunity onto her foal when it's first born, and they nurse that colostrum in the first 2 days of life. The other thing that is different with our broodmare, as we mentioned before, is that we do need to vaccinate them for rhino, the equine herpes virus 1, the abortive form of this. And remember, we're going to be using the killed vaccine, generally the pneumobort K, and this, in addition to the others, needs to be given at the 5th, 7th, and 9th month of gestation to do the best job of protecting those mares from rhino. For the newborn foals, they're a little bit different because they do not have any immunity and they have not been pre-vaccinated. So for those newborn foals, in the first year, most of their vaccines for the core-based and risk-based types of vaccines are going to require 3 doses. Need to check with them. I believe rabies might be one, or some might only require 2 doses, but most are going to be a 3-dose type of situation to get their antibody titers up to where they need to be. So if you remember back that graph where the foal's immunity and the antibodies from the mare begin to decline off, now we look to vaccinate the initial for these foals somewhere between 4 and 6 months of age, which is a little bit later what previous practices had been. Then we look to do that somewhere a month to a month and a half after this first vaccine. Then a 3rd dose is generally recommended, which is going to be at 10 to 12 months of age, and then they're on the program just as with all your other adult horses. And this is for our core-based diseases of sleeping sickness, tetanus, rabies, West Nile, and for most areas also your influenza, rhino, and strangles. In addition, just as we mentioned on our adult horses, it really is recommended for our foals for the influenza and the rhino, the respiratory type rhino, that we potentially might need to vaccinate them for that every 60 days. So a little bit in summary with this, the vaccination really is a very important portion of your overall health care program. Remember that we both have core diseases and risk-based diseases, and you're going to look at the individual horses to see what's the most important way that you need to vaccinate them. Remember that even the best vaccines are not 100% effective. Some are going to be higher than others, but they're not going to be 100% protective, and so you still do need to use good biosecurity and smart management practices to minimize any chances of diseases for your horses, even if they've been heavily vaccinated. Also on our broodmares, the hyperimmunization that we do for them is going to increase the colostrum quality that's going to provide better protection for those newborn foals. Thank you.